I am giving you 5 spotters for your perusal. I'll give you few seconds for your attention. If you want more time, please pause the video. Okay, let's go. This is the first case. Take your time. Are you ready? The answer I'll tell you. This is CT abdomen done in plain and after contrast focusing the liver. There is a large densely calcific mass in the left lobe of liver with poorly enhancing membranes and septae, and there is non-enhancing thick walled capsule that you can see that. It's very stable and there is no breach even though the stomach wall appears close to it. Plain would have given the full diagnosis and the contrast might give some misinterpretation. This is a very classic calcific hydatid cyst in the left lobe of liver. That's the answer. Now I am giving the second case. Take your time to give the diagnosis. This is ultrasound pelvis focusing the bladder. If you want time, you can pause the video and you can go through that. Now I am giving the answer. There is evidence of calculus in the posterior bladder wall. We don't know whether is it in the intravesical UV junction or in the bladder lumen. So that ultrasound was done after moving the patient in oblique and prone positions that you can see the images. It confirms presence of calculus in the intravesical portion of UV junction bilaterally. Actually, this was done after CT abdomen plane and we wanted to rule out whether it is in the UV junction or is in the bladder lumen. So that's why the ultrasound was done. You could have repeated the CT in prone position, but that will give some radiation. Ultrasound screening confirmed this. Ultrasound was also done to rule out simple or complex erythroceles and there was nothing to say about erythroceles there. So the diagnosis is calculus in the intravesical portion of right and left UV junctions, right? Okay, we will go to the third case. This is ultrasound image done in the epigastric region in the sagittal view, mid-sagittal view. Think about and a complete diagnosis is needed. Can I go? The answer? Epigastric ultrasound is giving the left lobe of liver. Anterior to the liver surface, there is free fluid with multiple hyperechoic foci, especially the left one, you can see it very well, which is indicative of free pneumoperitoneum with mild to moderate degree of ascites, which is highly suggestive of visceral perforative peritonitis. You can see the erect X-ray abdomen, which confirms the presence of significant pneumoperitoneum. The surgical diagnosis is duodenal perforation with peritonitis. Now we will go to the difficult fourth case. There are too many findings and please give your attention. If you want more time, please pause the video. Take your own time and give the diagnosis. Can I give you the answer? Ultrasound and CT of the liver show heterogeneous multinodular mass in the entire right lobe of liver, probably involving segment 4 of left lobe, with high suspicion of IV thrombotic extension of the mass. With this suspicion, it is better to evaluate the lungs, but I am sorry we have not given the chest images. Now you can please give attention to the given topo. CT abdomen topo. Remember, when you see nodules in the hepatic region in an X-ray or in topo, they might be due to either calcific liver nodules or they might be due to metastatic lung nodules, means non-metastatic lung nodules also can do that. In the given CT abdomen, there is no calcific pattern in the liver, multinodular mass in the liver. Now in addition, you can see the CT chest topo here, which is showing multiple nodules in both the lungs. So the final diagnosis is hepatocellular carcinoma with IVC thrombus giving metastatic nodules in both the lungs. But remember that the hypoechoic pattern in the IVC might be seen in most of the patients in the arterial and portal venous phases, especially the early portal venous phase. Don't judge them as thrombosis in the retrohepatic IVC. The retrohepatic IVC will show full enhancement in late venous phase or in the equilibrium phase with no evidence to suggest any thrombosis. Okay. Now we will go to the last. This is the last and easy fifth case here. you have to think about the diagnosis and the signs. It's simple and straightforward. Okay, let's go. This is ultrasound neck with Doppler focusing the right carotid. You can see the spectral flow pattern in the Doppler. All of them are highly characteristic of carotid pseudoaneurysm with a typical yin-yang sign or Pepsi sign. So that's the end of the session. This has been given as a quiz and the results are given with grading. I have to thank everyone who has participated in this quiz. Congrats to the winners. Thank you. Take care. Bye bye.